That works. Okay. All right. We are really excited about this next session. Many of you were with us in our last annual meeting that was held in Malaysia, and you remember that collective action where we came together and launched the Planetary Health Roadmap and Action Plan. And here today, we're actually going to hear more about that progress on that action plan. And this is a progress that comes from our entire community. We've had so many individuals from across the globe who've been working with us on this over the past 18 months, and here is a session to really celebrate that. So I will invite my panelists to join us. We will be hearing first from Professor Tan Sri Dr. Jamila Mahmood, who's the Executive Director of the Sunway Center for Planetary Health at Sunway University in Malaysia. She was the co-lead of the program committee for the annual meeting. We had the pleasure of working with her then. She has more than 2 decades of experience managing crises in health, disasters, and conflict settings. She's going to pull me off the stage if I say anything else, other than that she is a huge champion for the planetary health, planetary health movement, and we're delighted to have her here. And she will be joined by her colleague, Oliver Lacey Hall, who's a strategy advisor at Sunway Center, and then by my dear colleague, Tulsi Modi, who you've already seen doing 9 million things here, because that is what Tulsi Modi does, 9 million things to help our community. So over to you all.
Thank you very much, Jess. Yes, I was going to pull you off the stage. Hello, everyone. It's lovely to see all of you again. And it's really great to be with you today, reflecting on all that has happened since we last met in Kuala Lumpur last year. And the last 18 months have just been extraordinary. They have been turbulent, at times exhausting, and yet filled with moments of progress and hope, and a lot of friendship, I would say. We gather here not only to celebrate what has been achieved, but also to remind ourselves of the scale of the challenge still before us, and of the courage and conviction we will need to meet it. Let me first of all begin by extending heartfelt thanks to Erasmus University, Chiara, for your amazing leadership and work in hosting us here in Rotterdam, and to the Alliance, of course, for making sure that we get together regularly. From my own experience in Malaysia last year, I know just how much effort, care, and commitment it takes to bring a community like this together. So you have done it with generosity and purpose, and we're all very grateful. Last year in Kuala Lumpur, we challenged ourselves to confront reality. We spoke of moving from evidence to action. This year, our task is to act with urgency and agency for systems change. It is the natural next step, but also a daunting one, because systems change is not about incremental tweaks or marginal improvements. It's about rethinking, redesigning, reimagining the foundations of the way we live. It is about courage. It's about persistence and imagination, as Maisara puts it, being incredibly annoying. And above all, it is about recognizing that the responsibility belongs to all of us. The urgency couldn't have been clearer. July 23 was the hottest month in recorded human history. From June 23 to May 2024, every month set new records for global heat. We are now living in a world that is consistently warmer than 1.5 degrees above pre-industrial levels, as Johan has also illustrated to us. Now, 1 in 4 deaths worldwide is linked to environmental risks that are preventable. 1 million species face extinction. You've heard all this before. They are not just numbers on the chart. They represent lives cut short, futures diminished, ecosystems unraveled. They are our families, our neighbors, our communities. And as Johan presented the harsh reality now, we have crossed 7 of 9 planetary boundaries. This is why urgency matters. But urgency on its own is not enough. A sense of crisis can wake us up but it cannot sustain us. Urgency must be matched with agency. Momentum requires people, and a movement cannot rest on the shoulders of a few. It must be carried by many. At FAM 2024, 6 working groups were formed under the Planetary Health Action Roadmap, or Roadmap Action Plan, and they were filled with enthusiasm at the onset. But over time, participation slipped. That is not unusual, but it is telling. It reminds us that true movement building depends more than a burst of energy. It requires shared ownership, collective responsibility, and sustained commitment. And yet, even with these challenges, much has been achieved. And those achievements are worth celebrating because they are proof that with determination, progress is possible. Together, we developed a composite index to measure planetary health across human, environmental, and social dimensions, which you will hear of later this week. Internews, our partner, carried out a global stakeholder mapping and analysis. It showed us what many of us already suspected, that planetary health is still being discussed in fragmented ways. It highlighted the need to engage far more actively with stakeholders and influencers outside our traditional circles. Playbooks have been produced, monitoring and evaluation frameworks created, and new tools prepared to track our journey forward. We launched a network of journalists across Asia-Pacific. More than 120 media professionals are now connected, and 6 organizations work together to train them in planetary health. The interest was overwhelming. Each of the 4 workshops attracted upwards of 250 applicants with only space for 30? Clear evidence that there is hunger for knowledge and stories that connect people with these urgent issues. In education, we finalized new curriculum guidance, a policy toolkit, and storytelling materials. The Let's Teach Planetary Health webinar mobilized educators globally, proving that teachers and students alike see planetary health as central to learning. In global governance, we invested in building the capacity of the Planetary Health Alliance members to engage in multilateral processes. Many who had never set foot in an intergovernmental meeting are now able to analyze legal text, navigate diplomatic arenas, and turn passion into effective advocacy. In business, we convened small, medium enterprise and multi-stakeholder groups, laying the foundations for leadership programs that can help shift the focus from return on investment to return on values. The mainstreaming group developed the Planetary Health Handbook and Toolkit, and a new working group was launched on AI and innovation to ensure that technology is used wisely and responsibly. With thanks to our friends in Latin America, the roadmap has been translated into Spanish and Portuguese, and by our center into Bahasa Malaysia, and we want to ask for many of you to step up if we can start doing this in French, Arabic, Chinese, Russian, all the different UN languages. And crucially, we also adopted the Sunway Charter for Planetary Health, or the Faith Charter, reminding us that values, ethics, and spirituality are not afterthoughts, but central to our collective response. And then there is my country, Malaysia's bold step forward, inspired in part by the momentum generated at FAM 2024. Malaysia is launching the world's first national planetary health action plan. It's pioneering, it's ambitious, it's bold, and it's already encountering economic, political, and social challenges. But it is real, and I will invite you to think of Malaysia as a planetary health laboratory, a place to test, to learn, to innovate, a place from which the whole world can draw lessons, inspiration, and courage. And we're very fortunate to have with us later to speak Emeritus Professor Dr. Asma Ismail, who leads the Malaysian Academy of Science Working Group, walking us through this together. Now, this is an impressive record that our community can be proud of, But we must not be complacent, because the truth is that momentum is fragile. The coordination of this work so far has been carried heavily by 5 organizations: the Planetary Health Alliance, the Pacific Disaster Center, Georgetown University, Sunway Institute for Global Strategy and Competitiveness, and our Sunway Center for Planetary Health. Each has given time, resources, and leadership. At Sunway, we have invested heavily in governance, communications, and business engagement. Georgetown has nurtured early career researchers, and the Alliance Secretariat has led in education and mainstreaming. PDC has steered the measuring work, and beyond these, more than 100 volunteers from across the planet offered their time and expertise. But we cannot build a momentum on 5 sets of shoulders or on voluntarism alone. If systems change is our goal, then the responsibility must be shared more widely. It must involve everyone here and far beyond this room. And we must also confront the world around us with honesty. The global political environment is deeply challenging. Rising nationalism, intensifying polarization, resurgence of autocratic behavior in some states are all making international collaboration harder than ever. These trends have the risk of fracturing alliances, slowing progress, and can leave us feeling demoralized and battered. But let me say this clearly. This is not a reason to stop. Quite the opposite. When the political environment is hostile, when hope feels thin, this is precisely when courage is most needed. And this is the moment to redouble our efforts, to seek resources with creativity, to innovate, and when required, to be outspoken and annoying. Our messaging must be clear, focused, strategic, and challenging. And as we have heard from the many experts and speakers already today, the stakes are just too high for timidity. This is not a time to retreat. This is a time to act together with greater conviction. And as Nobel laureate Maria Ressa from my region said at the UN General Assembly last month, choose courage over comfort, facts over fiction. If planetary health is to matter, it must go beyond the halls of academia. It must show up in boardrooms where economic decisions shape the future. It must be present in parliaments where laws and budgets define what is possible. It must be in classrooms where new generations are forming their values. And it must be lived in communities where resilience is tested daily. And if we remain only within our comfort zones, speaking only to each other, we will fail. So we must push ourselves into new spaces. We must ask the hard questions. What do interacting planetary boundaries mean for people, for communities, for systems of governance? Which systems collapse when another falters? And who do we fail when we fail to act? These are not academic questions. They are existential ones, and they must guide us. The tools are ready. The evidence is overwhelming. The reality is undeniable. What remains is courage, creativity, and collective action. And these are the ingredients we must bring into the workshops and discussions here in Rotterdam. It would be a tragedy if we left this gathering without using the frameworks and tools devoted and developed with such commitment over the past 18 months. So my call to you is this. Let us celebrate what has been achieved. But let us be braver, bolder, and more united. Let us push beyond safe conversations and take planetary health into spaces where it has never been heard. Let us show by our actions that urgency can be matched by agency. When we leave Rotterdam, let us not leave as advocates alone. Let us leave as living examples of planetary health in action. Because of the health of people and the planet and all living things on it depends not only on what we have said here today, but on what we will choose to do tomorrow. Together, we can make planetary health real. Together, we can ensure it becomes not just an aspiration, but our legacy. And we must believe in hope. I was reminded that Martin Luther King did not inspire people by saying, "I have a nightmare." And Jane Goodall, right to the end, reminded us on the importance of courage and hope. Thank you very much, everyone.
Gosh, how to follow that? Jamila, thank you very much indeed. Ooh, just get this the right height and see if the clicker works. Where do I point it? Oh, great. All right, thank you very much indeed. So Jamila, thank you very much indeed for kind of laying out the broad framework there. From my perspective, it's really nice to be back here a year and a half after we all met in Malaysia and give you a report back on some of the work that's been going on over that time. I'm going to do that together with Tulsi because PHA and the Sunway Center for Planetary Health have been working very closely together on kind of guiding this whole roadmap process. Let me start really by saying thank you very much indeed to the leaders. Jamila touched on who they are: the Planetary Health Alliance, the Pacific Disaster Center, Georgetown University, and what I think we can call the sort of Sunway University family. And of course, the many, many people in this room and who are not in this room who got up early in the morning or stayed up late at night to join and attend the meetings that have brought what we're going to describe now to life over the last 18 months. This is really just a taster. There are sessions on all of these, the work of all of these 6 working groups taking place over the next 2 or 3 days. So really this is just to give you a taste of where we're at. As Jamila said, the roadmap identified 6 areas of work where progress would make a difference, and Tulsi and I are going to run through those now. So let me start with measuring, and we're trying to sort of describe what we've done against what the action plan called for, and what we hope will happen next. But our hope on what happens next very much comes down to people who are here this week saying you're going to join us in that process, that you agree with where this is going, and so on and so forth, which is what the smaller groups are for. I think we all agree that, and I think Johan and colleagues in the previous session made it really clear, and Sam, of course, measurement is really the foundation of progress. We can't manage what we do if we're not able to measure it. And so, okay, thank you very much. And so Pacific Disaster Center and the Sunway Center for Planetary Health have led this group of people on developing a global metric and a national level composite assessment. Those have been completed in what I think we can call a sort of first go format, and the results of that will be released and discussed tomorrow at the session that's going to be held on measuring planetary health. So we have some tools now to monitor progress, to identify gaps, to adjust course, as well as the beginnings of dialogue across groups who are working in this field. So next steps are that the initial assessment will be published, will be peer-reviewed, and we would like to make sure that as part of that process, conversations start with Johan's team and others who are kind of looking at various aspects of this kind of measuring. And I think also look and see if there are ways in which we can perhaps use Malaysia or other countries to start thinking through building capacity so that countries can apply this kind of evidence directly to policy. I think the goal is pretty simple. Simple is consistent, transparent data that drives real decisions. Second is, yes, communications, which I have I've had the pleasure of leading over the last 18 months. A very active working group, lots and lots of meetings since we really kicked off in September last year. I guess the key element is the delivery of the Voices for Planetary Health report, which we commissioned through Internews. Thank you so much, Internews, for the amazing piece of work that you've done there. That consists of a research document, 9 playbooks for how we can start to engage fairly systematically on communications with particular stakeholder groups. I think a copy of that was passed to everybody who's in this room today, so if you haven't had a chance to look at it yet, please do. Kind of beyond what we were asked to do in the roadmap, which was really come up with a kind of global communications plan, and I think we've got some of the nuts and bolts of that. There's been some additional activity going on around training media professionals in Southeast Asia. We've run 4 workshops over the last 18 months, training 120 journalists, and from that pulled together the beginnings of a media professionals network, which has a Google Drive, a WhatsApp group. We are starting to really see the benefits of people communicating across that. More on that on Thursday. And also included in the National Planetary Health Action Plan, which you will hear about shortly, is a really clear set of plans around behavior change and communications. And we hope that we can, as Jamila has said, use Malaysia as kind of the test case to help build this stuff out more broadly across the planet. Next step, hopefully we can identify somebody to take on the leadership of the communications working group. I think, the sense is that these things should, to a certain extent, rotate. We want to see how we can use the playbook, standardize those across the regional hubs and across the members of the Planetary Health Alliance, some discussion there. Find money, if we can, to roll out media training in other parts of the world, and do the same with the journalist network, and maybe webinars based on what is happening in Malaysia around the implementation of the National Planetary Health Action Plan. Next area that we've been working on is governance, really focusing on providing this capacity building that Jamila has talked about for PHA members on global governance. We've focused a lot also on young people, on youth, training them in governance skills via the global governance strategy. And tried as much as possible also to ensure that we've kind of got joined up coverage across the global range of intergovernmental meetings. There's been a case study on the World Health Assembly, on the UN Ocean Conference, and the UN climate change meetings. And also we've developed a theory on international law, global governance, and diplomacy for planetary health by really sort of quite carefully tracking negotiations and evaluating inflection points. Where we want to go next, I think, is looking at who's leading this and how is this being led, which organization should be front and center on this. Real focus on education, on training courses on global governance for planetary health, and see if we can get some kind of centralized platform set up to track intergovernmental negotiations and develop related communications campaigns. We talk about the need for systems-level approach. Sadly, global governance is as siloed as anything else. From my side, we also have been working on the issue of balancing business and planetary health. This came up very strongly. We had quite good private sector engagement at FAM 2024. And out of that, we have had the work being done by the Summer Institute for Global Strategy and Competitiveness around engagement with the private sector. They've engaged with 26 small, medium enterprises across sectors, including pharmaceuticals, textiles, agriculture, and the team has designed a planetary health training program for SMEs, while the already established leadership training transition program has reached 165 executives from 59 companies. And that's across plastics, electronics, chemicals, and education sectors. And I think starts to show that transformation can be mainstreamed across industries. The aim is that we expand this project regionally across, at the moment it's in Malaysia, we expand it across ASEAN slowly and carefully, and extend engagement to larger corporations and their supply chain. There'll be careful documentation of what's going on through case studies and through continued leadership right the way through the end of 2027. And then finally from our side, and I know this has kind of been very much on the agenda in everybody's minds, I think, artificial intelligence. And we kind of realized that this was becoming quite important since the last Planetary Health Annual Meeting. And we went out to the group and everybody agreed that we should have a working group looking at artificial intelligence. So that was set up in June or July this year. There's nothing really in the action plan around artificial intelligence, but we've started to put such stuff together, i.e. the establishment of the group, pulling together some core messages for public and business audiences on something called pro-social AI for planetary health, more of which you'll hear about during the course of this week. We've done a sort of stakeholder mapping across Malaysia, and we're beginning that for ASEAN. And in order to try and get our ducks lined up and our thoughts sorted out, started the work on a white paper looking at pro-social AI for planetary health in Malaysia, and a strategy outline for a broader piece of work on that, looking at where we go next. So for the next steps here, continue the AI working group through 2026 and hopefully 2027, looking at really kind of developing positive use cases for this pro-social approach to artificial intelligence. We recognize the need to start developing a suite of knowledge materials for educators, for youth, and for critics as well, and to really move this whole process forward, more of which you'll hear about during the course of this week. From my side, that's it. Tulsi, over to you. Thank you very much indeed.
Thank you, Oliver, and thank you, Jamila. I've turned my phone on Do Not Disturb, so if you're sending WhatsApp message, I'm not looking at them right now. So I want to talk a little bit about education. So one of our working groups, education led by my colleague Jelena, has been developing, and a lot of this is available on the PHA website now, quite a bit of deliverables. So I'm going to, Jamila kind of gave the teaser, I'm going to give the trailer, and then you can see the full Christopher Nolan type movie at the education session on Thursday. So one of the big product outputs of this are 3 videos on the global nature of planetary health. Each of them are about 8 minutes, and they focus on different things. They showcase diverse perspectives on global and environmental crises, highlighting the interconnectedness of planetary health challenges. So they're organized into 3 themes: personal experiences, awakenings, and planetary health success stories. And these stories are designed to spark constructive conversations about planetary health challenges and serve as powerful resources that can be used in classrooms and beyond. The second output that I really want to highlight here is a policy toolkit. And all of these are also on the website. And it'll be launched with an explanatory video and introduce a crowdsourcing component. This is a hands-on resource that helps educators translate planetary health concepts into scientific evidence, into clear and actionable policy briefs. And then the third is one that Jamila mentioned earlier on about this webinar that we just had this overwhelming interest of over 250 participants, mostly from higher education. And the goal is to reach more primary and secondary educators. But this team intends to continue this series beyond FAM. The webinars are created to be inclusive and accessible and welcoming to educators across disciplines and geographies. So they introduced foundations of the Planetary Health Framework, they shared open access teaching resources, and gathered input from participants to inform the future educational initiatives. And then I want to talk a little bit more about mainstreaming. So this was our 6th working group, and much like roadmaps and much like plans, it all requires a little bit of updating. So while we set out to make this an independent group, what was really amazing was to see how each of our working group leads, the measuring, the communications, business, governance, and education, took on mainstreaming within their own line of work and their own responsibility. So the work that I was doing was actually becoming quite redundant because they were taking charge, and that's really a testament to what should be happening. So while they were doing that, some of the work that I worked on with the mainstreaming group was reaching out to the planetary health community and to showcase how different initiatives, different groups, and organizations have mainstreamed planetary health in their own communities. And we have published some of those exciting initiatives on the PHA website that you can refer to. But it just really shows that there are multiple paths forward and there's multiple ways to mainstream planetary health, and they differ globally, and we want to embrace that. And with that, I want to, again, just plug in the upcoming parallel sessions that we have. So you can see here some of the upcoming sessions this week. Please look over the schedule and the agenda and attend them. This is where you're really going to get into the weeds of what they've been doing and what action is still remaining and where they are going next. That's it. Got it.
All right, nope.
No, wait.
Back to your chair.
Sorry, you can't get away back.
Thank you so much. You too.
Me too?
Boy, it's an unruly group. All right, thank you so much for really an amazing kind of explication of all of this incredible work that got started in Malaysia and has carried on since, and all your leadership in making that happen. So you guys have to stay here for photos. Are the photos done?
Not yet.
All right. In the meantime, I get to preview the next session, which will be short but immensely exciting. When Jane was asking me what would give me hope, this is one of the things that I was thinking about. I see it as a huge advancement for the global field. We've heard a lot about siloing, and Oliver just mentioned that the policy community is also siloed. I remember a conversation that I had with Ava Richardson, who's here from Baltimore and runs the sustainability office, at one of our dinners last month, where she was describing trying to develop commitments to decarbonize Baltimore as a city, and the challenge when they actually sort of did an accounting of the jurisdictions that would be relevant in trying to carry out those commitments, and it's something like 16 different jurisdictions that were relevant. And so the challenge of actually making progress with something as holistic as planetary health when our policy is done in these very discrete silos. And so efforts in the policy space to impose a more holistic framework and a sort of all-of-government framework to achieve some of our goals are few and far between, and it's incredibly exciting to watch them slowly starting to emerge. There have been, in addition to, I guess now we can let Tulsi and Oliver move along, but we're going to keep Jamila here, and we're going to acknowledge